All right, Maria. So after going through your medical history and oral assessment, I'd like to discuss with you my findings. Does that sound okay? Okay, great. So first I'd like to talk with you about the high blood pressure medication, hydrochlorothiazide, that you're taking. I just wanted to let you know that there is a chance you'll experience what we call orthostatic hypotension. Um, and this is just basically when you get up too fast, you may feel lightheaded or dizzy, with possible blurry vision and or weakness. So I'll make sure to keep appointments short and slowly raise you up. And then I'll just ask that you get up slowly out of the chair when leaving. And if you feel any of these symptoms, please let me know, okay? Great. All right, so after completing your oral assessment, I have found that you have generalized gingivitis due to some deeper probe depths, inflammation, and bleeding. Have you ever heard of gingivitis and its effects before? Oh, yep, you've got the gist of it. So, gingivitis is when plaque or bacteria builds up and becomes hardened on your teeth and irritates your gums, causing them to become inflamed and red. Now, over time, this can lead to tissue damage in your gums. But luckily, gingivitis is 100% reversible with good and consistent oral care. However, if the gingivitis is not treated, there is a chance that it will develop into what we call periodontitis. Are you familiar with what periodontitis is? Yep. It's an irreversible gum disease where the bone and supporting structures that keep your teeth in your mouth are permanently damaged. And because its side effects are extensive tissue damage, the gums surrounding the teeth eventually begin to form deep pockets where the bacteria and food particles will nest and then further compound the disease by creating more inflammation and more destruction of the tissues until eventually the teeth fall out or need to be removed. And eventually, if periodontitis is unfortunately, periodontitis is not reversible. So once there has been that bone loss, it cannot grow back. And that's why it's really important to catch gingivitis when we can, so that way we can prevent it from possibly progressing into that periodontitis. At this point, I would then show my patient Maria some visuals on the process of gingivitis and periodontitis, and show her the differences between the two. During your assessment, do you remember when I asked you questions about your eating habits, lifestyle, and oral habits? Yep, those were questions I asked to help assess whether you are at a high risk for either periodontal disease or for cavities or caries, tooth decay. And so from what I've gathered, you are at a high risk for your gingivitis progressing into periodontitis. Without proper oral hygiene care, both at home and at the dentist, you are at a moderate risk of developing tooth decay as well. I also noted some gum recession in several areas of your mouth, so I can talk to you about this too in a little bit. I know this is a lot of information to take in at once. Do you have any questions about what we just discussed? And then I would answer any questions she has. Yeah, you're doing a great job wrapping your head around all of this. It's a lot to take in. You're doing great. So are you interested in taking the first steps toward reversing your gingivitis and getting your gums back to health? Oh, I'm glad to hear. Awesome. So the best way to combat gingivitis is with good oral hygiene. I know brushing and flossing are something that everyone learns as a child, but there are several ways to brush the teeth. May I show you one of these alternative techniques that could help combat your gingivitis? Have you ever heard of the Bass method? I would then explain the Bass method to her and show her how to do it on the Typodont, really emphasizing using a light pressure and soft bristled toothbrush to avoid gum recession. You told me that you usually only brush one time a day. To remove the plaque bacteria that is causing the gingivitis in your gums, we need to physically remove it, and this is done by toothbrushing. So ideally, we want to brush twice a day to remove that plaque buildup so it doesn't have enough time to sit on the teeth to really irritate the gums. But because brushing only removes the bacteria that is on the surface of our teeth, it doesn't remove the bacteria that gets in between our teeth, because the bristles just can't get in those little tight areas. And so that's why it's also important to floss once a day. You told me you do not floss. Is that correct? Okay, and what are some barriers that you have found in flossing? And yep, like brushing, there are certain techniques with flossing that will help you to fully remove the bacteria. Would you mind if I show you those? So then I would use the Typodont and some standard floss, and I would show my patient flossing techniques, and then I would have her show them back to me on the Typodont. So in my assessment, Maria, I calculated your plaque index score, which is a percentage of the number of tooth surfaces within your mouth that had plaque adhered onto them. So your plaque index score is 45%. That means 45% of the tooth surfaces in your mouth are covered in bacteria. This number certainly could be worse, but it could also be better. So what I'd like to do with you is actually have you brush and floss your teeth using the new techniques you've learned. That way we can see if you can reduce your plaque index score using those techniques. So then I would disclose her and I would show her the areas in the mouth where the biofilm is red and collecting. And then I would have her brush and floss her teeth using the new techniques she learned. I would then provide any feedback I see as necessary. And then at the end, we would see how she did overall by viewing the remaining pink areas. I'd briefly talk to her about the benefits about electric toothbrushes to help get those harder to reach areas. And I would also recommend that she use an electric toothbrush if she's able to. So Maria, I noticed on your intake that you put down that you're a smoker. If you'd like, I can share with you some information about how smoking affects your oral health that you may not know already. Okay, awesome. So did you know that you're at a higher risk for developing and progressing periodontitis just because you smoke? And smoking increases the rate of progression and severity of the disease. On top of that, as a smoker, you also have an increased chance of tooth loss compared to individuals who do not smoke, and it can affect the treatment and therapeutic outcomes for plaque-induced gingivitis. I know smoking is a huge change in a person's life, but are you interested on some information on how to quit smoking? Great, I'm so happy to hear that. All right, so I would like to see you back again in 6 months for another routine cleaning. Like we discussed, it is important to receive routine dental care because professional cleanings with our specialized instruments are the only way to remove the plaque on the teeth that is hardened and become calculous. Remember, once that plaque is hardened onto the teeth, it cannot come off by just brushing your teeth at home. It can only come off by us using our really sharp instruments. So 6 months may seem like a long time, but it'll go by fast, and it will be a good amount of time for you to practice the techniques you've learned to help combat that gingivitis. And we'll see if in that time we can reverse it, because I think you can do it. You definitely are able to do those techniques very well, and just keep it up. So, how about we develop 3 goals you would like to work on between now and your next visit to reverse the gingivitis in your mouth and really establish that good oral health? What would be a goal you'd like to work on? And then we would develop 3 goals, and they would be the first goal of brushing twice per day. The second goal would be flossing 2 times per week. And then the third goal would be to commit to scheduling her next dental appointment. And then finally, I would ask her if she has any more questions about today's visit and offer her encouragement and support in meeting her goals over the next 6 months.